Hi, I'm Iman Nabila. Today, I will present about post-traumatic stress disorder, PTSD. So let's start with a case study. Encik Ahmad is an engineer who travels a lot for his work and was supposed to board the MH370 plane. On that very day, he wasn't feeling well. So, he cancelled the trip and somehow had very fortunately avoided to be one of the victims of the ill-fated craft. Though he did not think that way, he did not see himself as very lucky. His mind keeps playing what happened if he boarded the plane, where he would be right now, and how his family and friends would feel. Everyone keeps telling him how thankful he should be. He feels so much of anxiety and fear. Could not sleep, could not work, and of course, could not travel for work. Quite often, we thought PTSD attacks people who actually experienced the incident. It is also possible for people who had not experienced it, but merely observed it happen, or for some who almost experienced it. So what is PTSD? PTSD is a traumatic event in which a person experienced, witnessed, or was confronted with an event or events that involve actual or threatened death or serious injury or threat to the physical integrity of self or others. PTSD is marked by 4 types of responses to the trauma. First, patients repeatedly recall the events either in the form of nightmares or flashback. Second, they will avoid any reminder of the traumatic events. Third, they feel constantly on edge. And fourth, they are plagued with negative thoughts and low mood. According to one estimate, almost 8% of people will develop PTSD during their lifetime. PTSD can strike anyone, but the risks of developing the condition are not equally distributed. Rates are higher in socially disadvantaged areas. Women may be twice as likely to develop PTSD as men. This is partly because women are at greater risk of the kinds of trauma that commonly produce PTSD. Rape, for example. Nevertheless, and for unknown reasons, when exposed to the same type of trauma, women are more susceptible to PTSD than men. So, what causes it? In one sense, the answer is obvious: a specific trauma. Yet, this is only part of the story, because not everyone who is raped or badly beaten up develops PTSD. PTSD develops when the person believes they are still seriously threatened by the trauma they have experienced. Why should someone assume they are still endangered by an event that happened months or even years previously? There are 2 factors. First is a negative interpretation of the trauma and the normal feelings that follow. For example, believing that nowhere is safe, I attract disaster, or I can't cope with stress. These interpretations can make the person feel in danger physically or psychologically. Second are problems with the memory of the trauma, partly because of the way the person experiences the events. The memory somehow fails to acquire a properly developed context and meaning. As a result, it constantly intrudes. The traumatic memory is like a cupboard in which many things have been thrown in quickly and in a disorganized fashion, so it is impossible to fully close the door and things fall out at unpredictable times. These factors change the way people behave. They may avoid situations that might spark a memory of the trauma, and will sometimes try to deaden their feelings with drink or drugs. Yet, these strategies tend to entrench and worsen the problem. PTSD can be treated with antidepressants or various kinds of psychotherapy. However, cognitive behavioral therapy (CBT) was the single most successful type of treatment. That's all from me. Thank you for watching.